Hi, I'm Dr. Rob Morgan, U.S. Medical Director for LetsGetChecked, talking to you today a bit about sexually transmitted disease, or STD, testing. What are STDs? As the name implies, these are diseases that are typically transmitted through sexual contact, but not exclusively through sexual contact. It's really through transmission of semen, blood, or other body fluids. And in addition to sexual contact, transmission could happen through IV or blood transfusion, IV use, needle use, shared needle use, of course. And so really, STDs, while thought of as just happening through sex, can come from other ways as well. How common are STDs? Very common. In fact, STDs are one of the diseases that are on the rise throughout the world, despite the fact that we've got adequate testing and despite the fact that we've got good treatments. So being on the lookout for STDs is important. What would be some of the signs or symptoms of STDs? Well, a lot of STDs are in fact asymptomatic, meaning you may not have any symptoms at all. But there are some more common symptoms that can occur. Things like burning with urination, this could be in men or women. In a male, drip or discharge from the penis, happening even weeks after a new sexual contact, could be an early sign that an STD is present. Other things like lesions on the penis or in and around the vaginal area, pain with intercourse, fever, any of these things could also be a sign that perhaps an STD is present. Are there different types of STDs? There are. Some of them can be bacterial, some of them could be viral, or some of them could be parasitic. What are the ones that are more common? Well, the ones that you may have heard of would be things like syphilis, chlamydia, or gonorrhea, or even HIV, which, if left undetected and untreated, can lead to AIDS. It's for these reasons and the fact that STD is so prevalent that we need to be aware of them. Are there things that put you at risk to get STDs? There are. First and foremost, unprotected intercourse, meaning not using a condom, and particularly if it's with a new sexual contact. Increase in other types of activities like IV drug use, where needles are shared, could put you at risk for an STD. Blood transfusions, while rare causes of an STD, could cause contraction of some type of an infection. Who should consider getting STD testing? Well, certainly if you have any symptoms that suggest it, things that we talked about earlier, like burning with urination, drip or discharge, pain with intercourse, a new lesion vaginally or on the penis, you should consider STD testing in those settings. Or if you engage in perhaps some risky behavior, unprotected intercourse, particularly if you're not in a monogamous relationship, or have shared in other risky behaviors like sharing needles with IV drug use, getting tested would be a wise idea. If you'd like to get a bit more information about STD testing or about STDs in general, I invite you to go to LetsGetChecked.com, where through a live chat or a phone conversation you can speak to one of our nursing team members.